know this terminology for the definition of homeostasis. It describes the relatively constant states maintained by the body. Let's talk about some examples of homeostasis. The first one is temperature regulation, which I'm going to go in detail about that in a minute. But before we get there, let's talk about some of these other examples. Regulation of blood carbon dioxide level, respiratory gas exchange. So again, when we inhale, what are we doing? We're taking in what? Oxygen. And when we exhale, what are we getting rid of? Carbon dioxide. Right? Now we take this breathing thing for granted. Because we don't really think about it, right? We just breathe. But let's say that we have a patient that has emphysema. How is that going to affect their gas exchange? It's going to be diminished. And it's actually a double whammy with emphysema because not only can they not take in enough oxygen, but they can't get rid of enough carbon dioxide. Okay. Now, in the beginning with emphysema, we can treat it by doing what? Giving oxygen, right? And what will the oxygen do? It's going to help them breathe, right? They're going to be able to take in that oxygen. But they're still going to have a problem with getting rid of enough carbon dioxide. And as the disease progresses, that oxygen really doesn't work anymore. Have you ever treated a patient or seen someone with emphysema, the late stages? Okay, so you got the oxygen turned all the way up. It's not really doing anything, right? I mean, they basically just sit in a chair and watch TV. They don't want to bathe anymore. They don't, because if they exert themselves just a little bit, they're out of breath. Okay. So, with homeostasis regarding gas exchange, it works great until we have a pathology. Look at something that's less serious than emphysema. Let's say a person has asthma. Okay. What happens with asthma?
The airway constricts.
Yeah, and how does the patient present with a lot of what? Shortness of breath and wheezing, right? Lots of wheezing. I don't know if you know this, but if we can't control asthma, it can lead to emphysema, and eventually, the patient will succumb to the disease. So it's very, very important that we can maintain the asthma symptoms. So what do we use to treat asthma? Yeah, lots of steroids, right? But you know the best way is to find what the patient's triggers are. Okay, it could be cat hair or dander, it could be cut glass, pollen. I found out that mine were spicy foods, which I love. I know, I love green and red chili, and wine. So I but then once we find out what the triggers are, we can avoid them, and we can control the asthma down, so we don't have to take so much meds. Okay, regulation of blood glucose levels. Let's talk about that. This is something that as a nurse, you're going to be seeing every single day, is the ramifications of uncontrolled what? Diabetes. So how does this work? How does our body control our blood Okay, so let's say that I brought in a bunch of donuts. And let's say that none of us are diabetic, okay? So we eat the donuts. What happens to the sugars in our blood? They start to rise, right? But then the hormone, insulin, is going to kick in, and it's going to bring those blood sugars down, which is the way it should work, right? That is a perfect example of homeostasis. Okay, the body detects that, hey, there's something wrong. We have too much sugar in the blood. So we're going to release insulin, and it'll bring it down. What if I bring in those donuts and we're all type 2 diabetic? It's going to shoot up, and that insulin probably won't kick in. Now with type 2 diabetes, the insulin still works. I mean, it still produces insulin, but usually not in enough quantity, and usually not at the right time. Okay? So, also what happens is, why do we tell our patients that have type 2 diabetes to eat like 8 small meals a day? Why do we tell them to do that?
Blood sugars.
Yeah, why? Why though?
Because it doesn't cause.
Because insulins have different peak levels.
Good, yeah, because remember I said that their insulin, they still produce it, but it doesn't always kick in at the right time. Well, let's say that I'm diabetic, I have type 2 diabetes, and let's say that I haven't eaten 12 hours. Well, what could happen is that my insulin's going to kick in, and it shouldn't, because my sugars are already way low, but now they're gonna get lower. And what's that called when my sugars get really, really low?
Hypoglycemia.
Hypoglycemia, and that's just as bad as hyperglycemia, right? So that's why we stress to our patients how important it is to eat 8 small meals a day. The other thing that they want to do is carry the little glucose tabs, right? Okay. We're going to spend a lot of time talking about diabetes because, like I said, if I was, let's say that I'm your patient and I have just been diagnosed with type 2 diabetes, and you come in to talk to me about my lifestyle changes that I'm going to have to make, what would you tell me? What are some of the things that you would bring to my attention? Because I know nothing about it. I don't know anything about what diabetes can do to my body. I know nothing.
Carrying sugars and complex carbs if we're going to eat them.
Good.
Studying blood sugar levels, 8 small meals a day,
Excellent.
checking your sugars, how important it is, when to dose, how to dose.
Excellent.
Wear good fitting shoes.
Yes, very good. These are all excellent. What else?
Exercise?
Yes, exercise, moving. Moving helps so much. What else? Well, when someone has type 2 diabetes, what parts of the body does it affect? Well, the kidneys, the eyes, yes. Yes, so
The liver.
yeah, so we want to make sure that they have yearly eye checks, right? One supplement that they can take is lutein. You can buy it over the counter. It really helps protect the eyes. What else?
The skin.
I'm sorry?
The skin, you have to do.
Yes. Yeah, absolutely. Their feet, they want to pay real close attention to their feet. They never want to go barefooted because if they have neuropathy, usually as it progresses, they can't even feel the floor. Yeah, they don't even know. They don't even know that they stepped on a nail or they cut their foot. You know when they realize it? When they get up in the morning and they see blood on their sheet. And then they're, uh-oh, where did that come from? And it's really bad because if they, along with the diabetes, usually comes circulation issues, heart issues. And so, we bring a vascular surgeon in to look at the foot, And, you know, they may have to amputate toes, very, very common with, type 2 diabetes. Now, what's type 1? Insulin dependent. No matter how healthy you are, you have to take insulin. I think, I know over the years with my patients, they really don't know. You know, I've had patients come in and say, you know, I've had diabetes for 20 years, and they want me to go see a kidney doctor. There's nothing wrong with my kidneys. Why would they want me to do that? So they were never explained what it does. Okay, and that's part of your job as nurses. You're going to be educating these patients. So we're going to talk lots about diabetes. Integumentary regulates body temperature. Integumentary is your skin. How does it regulate body temperature? You got it, which I'm doing right now. Are you? I'm sorry, oh my God. I say sweating is healthy, it's actually, I'm not, I should be. All right. So, when we're talking about homeostasis, all of these systems are involved. Digestion, cardiovascular, blood, heart, urinary, all of these things. Skin, they're all affected by homeostasis. So the homeostatic control mechanism, devices for maintaining or restoring homeostasis by self-regulation through feedback control loops. I want you to know that we have three. We actually have 3 feedback control loops. The one is called negative feedback loops. Number 2 is positive feedback loops. And number 3 is feed forward. Feed forward, and I'll explain them all in a minute. The basic components of the control mechanisms, we have a sensor mechanism, we have an integrating control center, effector mechanism, and feedback. The next thing that I want you to put in your notes is that in order for these feedback loops to work, they have to secrete hormones. So hormones are secreted into the blood, and information is transmitted in the control loops. Yes?
I'm sorry, what was the third one? Negative, positive, and
Feed forward.
Into the blood and what?
Into the blood, and information is transmitted in the control loops. In the sensor mechanism, specific sensors detect and react to any changes from normal. And we're going to see how that works in a minute. In the integration center, information is analyzed and integrated, and then if needed, a specific action is initiated. In the effector mechanism, effectors directly influence controlled physiological variables. Feedback is the process of information about a variable constantly flowing back from the sensor to the integrator. Okay, now that was a lot of verbiage. Now, let me show you what it all means, okay? So most of your anatomy books, when they talk about homeostasis, they like to use the house analogy, which I think is a very good one. So we have a house, and the temperature is decreased. So what's that detected by in the house? It's detected by the thermometer, okay? And once the thermometer detects that that house is getting colder, it feeds information via wires back to the integrator, which in this case is going to be the thermostat. And when the thermostat or the integrator gets that information, it's going to send a correction signal via electrical wires to the heater. And that's going to turn the heater on, and when that heater comes on, what happens to the house? It warms up. Yeah. So that diagnosis is a negative feedback loop. Why do we call it negative? We call it negative because it opposes the change. And what was the change?
The temperature.
You got it, the temperature. The temperature change, that is the change. So let's see how it works with us. Okay, we have a young lady that's hiking and the temperature decreases. Now here, it was the thermometer. Here, what's going to detect the change in temperature? Her skin receptors. The temperature receptors on her skin is going to detect a change in the temperature. So it's going to send information via nerve fibers to the integrator. Now the integrator for us is not this, it's going to be the hypothalamus. So in your notes, I want you to put the hypothalamus is our body's thermostat. It is our body's thermostat, the hypothalamus. So once it receives that information from the skin sensors, it's going to signal a correction signal via the nerve fibers to our muscles. And when the muscles receives that signal, what are they going to do? We're going to start to shiver, right? And that is going to increase our body temperature and warm us up. Does that make sense? So what kind of feedback loop is this? It's negative, right? Why is it negative? Because it's opposing the change. Okay, it's opposing the change. This is temperature regulation. This is how our body, every second of the day, maintains our core body temperature. Okay, and it will work until something happens, right? Like we get overheated. Or what happens if we do, like me, I'm hot right now, so what's my body doing? It's opposing the change, so it's allowing me to sweat so I can cool down. So negative feedback loop. So I always like to start out with temperature regulation. So it's the easiest to understand, right? But as we move forward, I am going to constantly be talking about these negative feedback loops because they help with everything. If you just look at our skeleton here, what do we have to have in our bones to keep it nice and strong? Starts with a C. Calcium, right? But we also have to have just the right amount of calcium in our blood. Okay? This works fine this system works fine until we have a pathology, like osteoporosis. Then what happens? These bones start to get brittle, right? And then what happens to the calcium in our blood, do you think? Yeah, it increases, right? Because too much calcium is being released from the bone and it's going into the blood. What's that called? It's called hypercalcemia. Hypercalcemia. Okay? And we're going to learn how negative feedback loops keep the calcium so that we have just enough in our blood and just enough in our bone, unless we have a pathology. Okay? There's also a blood cancer that causes the bones to become very brittle, and that will make our calcium levels in our blood sky high. Okay. So for your first exam, we're having a quiz on Friday, but for your first exam, covering chapter 1, part 1 and part 2, I'm going to give you select all the apply questions, maybe to start you out, I don't know, maybe 5. Okay. And I'm going to give you a really big hint. One of those select all that apply will probably be covering negative and positive feedback loops. So I want you to know all the characteristics of a negative feedback loop. They are inhibitory. They stabilize physiological variables. They're going to produce an action that is the opposite to the change that activated the system. Okay? When you're taking an exam, okay, especially with the select all that apply, read what it says and think about, if you just think about temperature regulation, right? You know temperature regulation is a negative feedback loop. So based on this picture, this really nice visual, and then reading this, does it produce an action that is opposite to the change that activated the system?
Yes.
It most certainly does. So you're going to write that down. They're responsible for maintaining homeostasis. Yes, they are. Every single system that we talk about in here, the only reason that it is running properly is because of these negative feedback loops. And they're much more common than positive feedback control systems. I want you to know all of these, all the characteristics of a negative feedback control system. And without even going any further, if we talk about positive feedback loops, what are you thinking? It's going to be just the opposite of the negative, right? Yeah. Okay, good. Very good. So temperature regulation by action of a thermostatically regulated furnace is a classic example of a negative feedback loop. Okay. So let's talk about positive. A positive feedback loop, instead of them being inhibitory, like we saw in negatives, they are stimulatory, which means what? What does stimulatory mean?
Activated by stimulation.
Yes, and it's going to increase the change. It's going to embrace the change. And that's what we see here. It's going to amplify or reinforce the change that is occurring. We don't want to stop the change. We want it to continue. What perfect example would that be for my moms in here that have children?
Lactation.
Lactation is one. But childbirth,
Childbirth.
yeah, just think about it. Whenever I say positive feedback loop, I want you to think of having a baby. Do you have children? Okay, so you remember when you were in labor, right? You would want me coming in and saying, wait, let's stop, let's sit down and play cards.
You know, they say that more often than not. Have any of you ever been told, oh, just hold on?
Yes.
Oh,
Hold on to what?
Yeah, that's it. Oh, gosh.
Don't finish, wait for the
I know.
wait.
Right. But in general, I mean, with a positive feedback loop, it's reinforcing the change. It wants you to have that baby. Yes, exactly. So, but it also, giving birth tends to produce destabilizing effects and disrupts homeostasis. Nothing disrupts homeostasis more than having a baby.
Your body's right.
Yes, but after you have it, bring specific body functions to a swift completion.
Which
And-
is like the lactation.
Yes, and then the lactation is also a positive feedback loop because you're experiencing a change, which is breastfeeding, right? But you don't want it to stop. So that it's positive, that's a positive feedback loop, it's stimulatory. Are we okay with this? Okay. So try to remember, not just for me, but as you move forward, a perfect example of a positive feedback loop is childbirth. Okay, there's other ones. There's a sneezing can technically be considered a positive feedback loop. Fever, a blood clot. But if you just remember pregnancy, or childbirth. Perfect. So what are some examples? We already said childbirth, lactation. Okay, let's talk about the last control system, feedback system. And it's called a feed-forward control system. Okay, now this is a little different than the positive and the negative feedbacks. What do you think it means, feed forward? It says occurs when information flows ahead of another process or feedback loop to trigger and change in anticipation of an event that will follow. I see where you're going with that, and yeah, kind of, because the body isn't in anticipation that something is wrong. Anybody else? I got this thing about donuts today, I should have wrote it in. If I bring donuts, and assuming you guys all like donuts, you smell the donuts, and what do you start to do? Salivate. And when you salivate, that actually starts the digestive process. Okay? So when I bring in the donuts, the body is going to assume that you're getting the donuts. Right? So the digestive system will start, which is a good thing. Okay? Most of the time, these feed-forward control systems work in our favor. There are times when they don't. I don't know if did I talk to you about the contest, the radio contest they had? It was a few years ago. If these DJs come up with this game, if you drink the most water, you would win a Wii Nintendo game. Did I tell you about that? Okay, well, it involves this feed-forward mechanism. So these women went to try to win these Wii games, and the woman that won, she drank a little over 3 gallons of water in a very short amount of time. Okay? And during that process of drinking the water, she felt the need to vomit, right? So she started to, but she forced herself not to. Well, our bodies are amazing in that with this feed-forward control system, if we're sick, let's say we have stomach virus, okay? And when we throw up, or we start to throw up, our body releases a hormone called the antidiuretic hormone. What do you think the antidiuretic hormone does? Yes, it helps us retain our fluids, so it stops us from urinating, or at least we will only urinate very little, if at all. And antidiuretic hormone. So this poor woman, when her body thought she was going to throw up, but she didn't, it still released this antidiuretic hormone. So when the game was over, she told her husband, she said, I feel like my eyes are floating. And she couldn't urinate. So the body, when we retain fluid, our bodies are very forgiving from the neck down. Why? Because we have skin that will do what? It'll expand. But what do we have here inside our skull? The brain. And the brain inside the skull has very little room for excess fluid. So when they got home, she said, I'm gonna go lay down. And he's not having his stuff. So she went lay down, he went in to check on her about an hour later, and she was having seizures. And by the time he got her to the hospital, it was too late, she died. But that was a perfect example of a feed-forward mechanism that unfortunately did not go in her favor. The other problem was, with this contest, they made them drink distilled water. What is distilled water compared to tap water? It's disgusting.
I did.
It is. But what is it? It's, when you look at distilled water on a pH scale, it's neutral. It has absolutely nothing in it. Okay? So, and we're going to learn this in the next week or so. But water follows salt, right? So all the water that she drank, because it was hypotonic, it was neutral, it didn't have anything in it, it went into her cells. Because water follows salt, and her blood cells were more hypotonic than her water. And that really hurt her as well. They were fired, by the way, these kids.
They were fired.
They were fired. Okay, I think that's all for here. Pathological anatomy, you want to know the anatomic changes that result from disease. Homeostatic mechanisms may not be as efficient during infancy and early childhood as they are in adulthood. And of course, as we age, they become less effective. And I'll give you a perfect example regarding age, is osteoporosis. Right? When we age and we develop osteoporosis, that negative feedback loop involving hormones, it's not effective anymore, or as effective. But how do we counteract that with osteoporosis? What do we tell our patients to do?
Weight bearing
Exercise,
exercises.
weight bearing exercises. exercises is the best. They actually now, when you go for a bone density test, they can tell you exactly where your osteoporosis is. You know, it could be in your hips, it could be in your femur, your shoulders, but it'll tell you, and they can give you specific exercises to work on it, on just that area. Okay, any questions on homeostasis? Do you see what I mean? If you understand homeostasis and how these negative feedback loops help us maintain homeostasis, then when you throw in a pathology, you kind of think, okay, I get it. I understand that now because it's disrupting homeostasis. And we can't survive if we can't maintain homeostasis. Okay? Either by medications or by surgery. But you know, we absolutely have to maintain homeostasis. Okay? And you'll see moving forward that when one system is compromised, it affects other systems as well. So I've never seen anyone that had cardiovascular disease that didn't also have kidney issues. And that's because what are the major causes of cardiovascular kidney disease? Drugs and alcohol and diabetes and hypertension, right? People are walking around with uncontrolled hypertension. They don't even know they have it. And why do you think that is? I've had patients, honestly,